Good afternoon, everyone, and welcome to our Kids Matter webinar titled Supporting Primary School Children with Anxiety. It's great to see so many people who've joined us this afternoon at our new time. We're trialling this 4:30 time slot in Melbourne and Eastern States, so we're very pleased to see a lot of interest. We've had interest from almost 1,200 people, and we can see that there's almost 400 online already, so I'm sure we'll add to those, and people from all around Australia. So thank you very much for joining us. I'm Lynn O'Grady, and I'm the National Project Manager here at Kids Matter at the Australian Psychological Society, and I've worked previously as a psychologist in schools in Victoria, so I'll be drawing on that today. And I'm joined by some panel members who are going to share their knowledge and experience as well. I'll introduce those in a moment. I'd like to begin with an acknowledgement of the traditional owners of the land and pay my respects to elders past, present and future. They hold memories, traditions, culture and hopes of Aboriginal and Torres Strait Islander Australians. And I think this is very important in terms of us all being from all different places around Australia to be mindful of that in terms of where we are. So I would like to introduce our panellists today, and we have Dr. Marilyn Campbell, and Marilyn is a professor at Queensland University of Technology and a registered teacher and psychologist. So she's going to be sharing with us some of her tips and ideas that she's been gathering over a long time in her work. And we also have Dr. Michaela Balderstone, a general practitioner from South Australia. So we thought it would be very helpful for us to be thinking about general practitioners' role and how they provide support to families and children, and how we can, working in schools or in the health or education sectors, we can really work in partnership together. So it's very important that we're hearing all of our voices this afternoon. In terms of the audience, we have people who are from working in schools, we have people who are teachers or psychologists and guidance officers and school counsellors, I can see. We have therapists, child development therapists, and we also have a lot of early childhood people who have joined us this afternoon, as well as people who work in the health and community sectors. So we're very pleased to have your input. And please use the general chat for your, I can see people are doing that and saying hello. As we go through, we're really interested in your comments, in any questions that you have, and we're really always glad when people answer each other's questions. If you've got ideas and experiences that you can share with each other, that's always good in the chat as well. And we also have a couple of people here from the Australian Psychological Society, Lisa and Nat, who will also be responding to some of the questions, and we'll also direct you to resources which are available as well. Just some ground rules, and I know a lot of people have participated in our webinars before, so you'll be familiar with these, but there will always be some people who haven't done this particular form of communication before. So just a few reminders there on the PowerPoint slide. So just mindful that this is, it's almost like a face-to-face activity, even though we can't all see each other. We can, any comments you include in the general chat we can see. So being mindful of that is always good. And being mindful of taking care of yourself during the session as well. So we know that hearing about mental health difficulties can trigger all of us. And so being mindful of that and looking after ourselves and knowing what we need to do to care for ourselves is really important. So comments and questions in the general chat box I've mentioned. For technical issues, you can use the technical help chat box as well. So we have great support from Redback to help us with any technical issues as well. So just jot down anything there and people will respond to that. And if you want to hide the chat, if you find there's too much chat and it's a bit distracting, you can click the small down arrow at the top of the chat box as well. And at the end, we will ask you to complete a short exit survey, because we really do value the feedback, and we do draw on it in terms of future planning. This afternoon session is really looking at a case study with James and Charlie, and hopefully you've had a chance to read that and become familiar with it and done a bit of thinking about it. We have received questions as you registered. You did provide us with lots of questions. We're going to try and cover many of those during the session this afternoon, but might not get to all of them. And hopefully by the end you will be familiar with the signs of anxiety in primary school age children, a better understanding about what might be underneath those signs in terms of the causes of anxiety, how it might impact, why it's an issue, and you perhaps know that already, And then be better equipped to support and respond to the needs of primary school children with anxiety. So that notion I talked about already about primary schools, health and community professionals, early childhood people and GPs all working together. So that's really the aims of what we're trying to do. We don't think we'll have all the answers for you tonight. We want these case studies to really trigger our thinking, provoke some thought, give you a chance to hear some ideas from people and have some discussion along the way. So I'm going to begin with a bit of an overview of anxiety and drawing on some of the work that I've done in primary schools and being a psychologist and anxiety being something that we often do hear about in schools. And I think the first point is that fearful and anxious behaviour is very common in childhood. So we want to be careful of not kind of worrying about every sign of anxiety or fearful behaviour. It's quite normal and quite healthy to have some fears and worries because it's very protective and protects us and keeps us safe if we do have some worries and alerts us that something might not be wrong. But probably the biggest questions are, when should we be concerned? What might it look like in a school setting particularly, or in an early childhood setting? What might be leading to that? And they might be questions that you're asking yourselves. And then what are the types of anxiety disorders we see in primary school age children? There's not just one type of anxiety, it can present in different ways. And then of course who can help with this? And we're very mindful with Kids Matter that we're very keen for teachers and people in schools to be aware and to observe and know what's happening for children and understand that, but then also to not feel like they're the only people that respond, they're the only people alone dealing with these concerns, that we're really wanting people to be able to feel supported by families and supported by community and health and community people as well. So if we think about what we might be concerned about when we might become concerned, is when children feel anxious more than other children of their age and level. So teachers and people in schools are very, very good at knowing this because they're working with children all the time. So they get to know that this is a fairly normal concern, or this is something that's a little bit out of the range of what would be considered normal for a child at this age and stage of development. When children are being prevented or stopping themselves from participating in activities at school or in social circumstances, that would be a time we might be concerned, and that becomes important in terms of their development and in terms of their mental health. When anxiety interferes with their ability to do things that other children their age are doing easily, and when the fears and anxieties seem to be out of proportion to the issues in their life. So we always need to be thinking about what might be a normal response to something that's happening, and what might be a temporary response, what might be something that's out of that, it's really out of, it's too big for the issue and what else is going on for the child. And if this is a concern and they become anxious more easily, more often, more intensely than other children, and not in context of a particular situation that might resolve, they might then get a diagnosis of a particular anxiety disorder. And this can include phobias, generalised anxiety disorder and separation anxiety. So these are some of the anxiety disorders, and I've taken this information from the most recent survey that hopefully you've seen. It's an Australian survey that was just released this year, the second Australian Child and Adolescent Survey of Mental Health and Wellbeing, 2015. And you can see there that anxiety disorders affect 6.9% of children in the age group of primary school, 4 to 11 years, more likely in boys than girls. And compared to other common mental health disorders for this age group, ADHD is a little bit higher, conduct disorders quite a bit lower, and major depressive disorder is lower as well. So it's always useful to be thinking about anxiety in context of all of that as well. And often children will present with anxiety alongside other things as well, and particularly around autism. So children with autism spectrum disorder may present with anxiety with that as well. So anxiety is not part of that autism spectrum disorder diagnosis, but children with autism can be anxious because the world can be a very unpredictable place for those children. At primary school, this would be what people would be already familiar with, so there'd be a longer list than this as well. But it can present in many different ways. And we know that children's behaviour is what tells us that there's a concern for them. They're not always going to tell us that they're feeling anxious, though some children might. But it can be around perfection, it can be around being afraid to ask for help or reluctant to ask for help. It can show up in social interactions, particularly social anxiety. It can be physical, somatic symptoms, so stomach pains and headaches. It can be showing up in fearful situations around tests or performing, so having to speak in front of others or to read in front of the class. It can be around separation, so upset when leaving parents. Where do they come from is a good question, and I guess it's that what I said before around is anxiety is important, or fears are important to keep us safe when there are dangers or threats. It's normal and actually very adaptive to be worried about that. But sometimes some people, and children as people, react more quickly or more intensely to situations that might indicate danger. So they might be more quick to respond, or they might be it might be a bigger response than what the situation warrants. Children might have an anxious temperament. We know that children bring their own temperaments into the situation, so some children might appear to be more anxious as part of who they are. Sometimes there can be stressful events that trigger problems with anxiety, and a number of those stressful events over time can mean that children become quite hypervigilant. Learning can be part of that, so they might learn from the adults around them. So often anxiety in children can be connected to anxiety in families, and the family members' response to the world around them can contribute to the child's idea about what's dangerous or not. And if we think about what's happening at the moment in the media and the situation overseas and language around terrorism and threats and sieges and things, if children are watching a lot of that and they're a little bit sensitive and aware and alert towards that, well then they might be showing some signs of anxiety. So it's important to be thinking about the world around us and what children are picking up on as well, so that we're thinking about how we might prevent some of those anxiety problems. Here's a list of the anxiety types. I won't go into a lot of detail. The slides are available in the document section, but certainly social phobia is obviously around extreme shyness, fears of how people are seen, so what people think of me. Separation anxiety people will be aware of in terms of being away from family particularly, and we often see that in younger children, but it can occur with older children as well, and can impact on things like school camps and just at the start of the school day. Generalised anxiety disorder is quite tricky because it's sort of not always easy to pinpoint what's going on for the child. So worrying about a whole lot of things without necessarily being able to pinpoint what it is. And then obsessive compulsive disorder is unwanted thoughts, worries about things like dirt and germs and needing things to be lined up, needing things to be just right, and becoming very overwhelmed and stressed if that's not happening. We know that psychological support is very helpful for children who are experiencing anxiety, and sometimes in quite severe cases medication might be required. So it's important to be mindful of that, important to support parents with some of those decisions as well. Early intervention is important if we think about anxiety potentially stopping child's development in terms of their friendships and their participation, which aid their development. Well, then we know that intervening early to get help is really important to building their capacity to cope well, build their resilience to different situations that they're confronted with. We know that it's important with all children's mental health issues to work closely with families, but for anxiety particularly because of the concerns that I talked about before. If we have anxious parents, we have anxious children and vice versa, so it can become a bit of a cycle. So supporting families, getting some help for them as well is a really important part of this. And when we're really concerned, referral to a mental health professional, whether that's within the school or with families to a GP that we're going to hear more about, or to other support services is really important. And again, looking at what else might be going on. So anxiety might be a possibility, but there might be other things happening as well. And really the strategies around psychological support are helping children to reduce avoidance and use more effective coping skills. Relaxation, mindfulness, we're really aware of, meditation, really aware of these days, and learning how to replace unhelpful thoughts with more helpful self-talk. So some of the sorts of work that people will be doing in schools and social emotional learning programs will be really important. And when children are really struggling with a particular fear, it can be very helpful to really go through a process of encouragement and rewards. That this is an example that was just taken from the Raising Children Network website. And you can see there that it can be quite an extensive process that the family might need to go through, taking a long time to build the child's confidence, reward small steps, so breaking it down into small, manageable, achievable, success-building steps. So that's just an example there of how that might take quite some time. Teachers can play a really important role and in their role modelling, and we can talk about brave behaviour, making mistakes, no one is perfect, so the messages that we send on a day-to-day basis, managing that with also not dismissing feelings or not saying you've got to be brave regardless of what's happening, but how do you manage feelings, and if you're feeling anxious or feeling scared, what are the words that you might use? But certainly helping children to respond and cope with the day-to-day situations that they're confronted with. And being more confident to ask for help if they need it, or to just have a go at things and not worry about mistakes. So children might need a lot of support and encouragement to do that. You might remind them of times when they've actually managed something in the past, and you might reward positive steps in facing fear, so breaking those steps right down. Excessive reassurance seeking and avoidance behaviours can be quite unhelpful to continue that, but finding ways to manage that is important, so that we're not just missing what they represent. So avoiding a behaviour is really around the level of fear, so helping them to feel more confident, breaking larger goals down into small steps, relaxation we've talked about, and positive self-talk. And we've got the example there from the case study with James saying things like, I never get it right, I'm stupid, might be encouraged to say something else, or picking up on those sorts of messages, self-talk messages. Range of other strategies here for schools, and I know people like lots of strategies, and I think some of those you might be feeling like you're doing already, and the structure and routine of schools, problem solving, thinking about the environment and what are the triggers for children, what can lead to them feeling anxious, and how can you break down assignments, planning ahead for school excursions or changes in routine for children, being aware of the types of pressures that these children experience when it comes to testing or timed activities or presenting, and really working with families and support people as much as possible. People have asked us about programs and which programs or what teachers can do in a more strategic, formal way, and there are programs on the Kids Matter Programs Guide that do look at anxiety particularly, so these would be in the Component 4 section of the Programs Guide. As you can see, a number of them there do look at programs that you can use either at a whole school, in a whole school way, or at a classroom level, or in small groups with a group of children. So again, it will depend on your resourcing and what's going to work, what's available in your school in terms of how you might do that. All right, now I've set the scene and given you lots of ideas already, I'm wanting to hand across to Marilyn, and Marilyn's going to talk in a little bit more detail about some of those things. Thanks, Marilyn.
Thanks, Lynn. First of all, I want to reiterate that we as people working in schools with primary school children will only see their behaviours. We can't actually see into their minds about what they're worrying. So I know you probably can't read all of this, but these are 32 items which might make it easier that if the child has a lot of these kinds of behaviours, then you might consider anxiety. So let's go through the case study, and I've grouped these behaviours into different sections. So for example, first of all, there's Charlie. Now, this isn't working. So there's no animations on here. So this is going to be very difficult because, well, Charlie shows many avoidance behaviours. He procrastinates over the tasks in school. He lacks concentration. Jeff, if you can make the names come up, that would be really good. He does seem to be daydreaming, and but James then, not Charlie, excessively checks what he has to do. Thank you. So we have Charlie coming up he's unsure of himself, he's easily embarrassed, he fears appearing silly. Now for James, he seems to be more of a perfectionist. He's eager to please. He excessively checks what he has to do. He seems to be irritable and persistent. And Charlie also might seem to be insecure. So you can see that Charlie probably, as one of the twins, seems to have more anxious behaviours than James does. But James' behaviours are quite different. So one of the take-home messages is that anxiety behaviours can look differently. When you read the case study, you might have only thought Charlie was the anxious one because he has those mainly shy behaviours that we think that we have when we talk about anxiety. But James also has some significant anxiety as well. So what do we do? This is a very difficult question because what happens is that we actually have different causes. We know that anxiety runs in families. So we know that some kids are predisposed to suffer excessive anxiety. But we also know that that kind of nature-nurture debate in that raising children has a great deal of effect on their behaviour. So we can do things. So for teachers, I've got 3 messages. The first one is, do talk about being scared. You're not going to make kids more anxious by talking about it, although I know that that is a myth that some people believe. If that was true, then what we could have is a lot of teenagers with risky behaviour saying, are you scared about riding your bike like that? And I go, no, what are you? And so you think, oh, good, I've talked about anxiety, therefore it's going to make him anxious. That's not how it works. Talk about anxiety in your classroom. You can do programs such as Friends and Cool Kids, but you can also embed your talking about anxiety in your teaching, and you can double dip. You don't have to have a whole program for it. So if you were talking about dinosaurs, which we do sometimes in primary school, you might like to read Danny the Frightened Dinosaur. He's afraid of thunderstorms, he's afraid of water, he's afraid of heights. And if you read that book, and you can teach reading from it, you can teach the illustrations from it, you can talk anything about that as in literature. Danny is a boy and he's big. How come he's scared? And then a lot of the kids will start saying, yes, I was scared sometimes too. Or you can look at Zilla the worried gorilla who has separation anxiety. If you think that there are a couple of kids in your class who might have separation anxiety, and Anthony the shy alien is socially anxious, Dig the fearful pig has got OCD, doesn't like getting his hooves dirty. So all of these books and many others you can incorporate into your classroom and generally talk about anxiety at a very level that is not pathological, say the word now, making it into a pathology. You're not saying that they have a disorder. Yes, some kids might, but all kids get fearful and anxious, so talk about it. Also, you can have, as Lynn has said, have a go classroom. Make mistakes. I just didn't mean to say, couldn't say pathological, but I couldn't. And I didn't say, oh, well, I was just testing you, that's why I made the mistake. It was a true mistake. And if you can say to kids, if you already knew how to read, then you wouldn't be making mistakes about it. I can't pronounce some words, so therefore I make mistakes about it. It's okay to make mistakes. This is a have a go classroom. And the third one is reward for effort. We really say we reward for effort, but anxious kids won't try. They don't want to have a risk of failing. They also don't sometimes even want to put a mark on the page because it's a beautiful white clean page. One kid I was talking with was 14 years old, carried around a notebook without anything in it in case you made a mistake in it, so it was just clean. So what you want to do is that you have to have a stamp for saying this is the correct answer, but you also need a stamp for saying, well done, you tried your best. And we all say that that's all we want them to do, but we often in practice don't do that. We also need to be able to, so there's a teacher's books with some of these teaching tips in it. I have 14 or 15 in there, but I don't have very much time to go through them all. But also for parents. Parents, if you have a sensitive child, then one of the things is not to doubt them, that you don't always do things for them that they could do themselves. Even if they're not going to do it properly, let them have a go. As it says before, if you think the world is a dangerous place, they'll pick up on that as well. You model self-regulation, you model calm behaviour and not worried behaviour, they'll pick up on that as well. And again, if the child has a phobia about taking swimming lessons because they're afraid of the water, you do the little steps, but you don't let them avoid it. But most of all, my take-home message for parents is be united. Don't let Dad say, I'm just going to throw her into the water and let her sink or swim, and Mum say, no, 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 she doesn't have to go because she's too scared. Work it out as parents how you're going to handle your sensitive child and stick together to do it. Thanks, Lynn.
Right, Marilyn, there was a lot of information packed into that, so hopefully people got those messages. The Have a Go classroom, I can see people talking about it, and reward for effort, and finding some middle ground, not the extremes. So that sounds really helpful. So thank you very much for that. And people are asking about where you can find those more information about what Marilyn's talked about, and we've got the website, we've got the documents on the right-hand side. You can see the documents, and if you look in the PowerPoint slides, you'll see, and there's a little arrow flashing now, you'll see the slides, and you'll see the slides that you're seeing on the screen. So hopefully you can find those and you find them and use them, would be great. So thanks, Marilyn. All right, now we're going to hear from Michaela, and Michaela, as I said before, is a GP, and she's going to give us perhaps a different perspective. So thanks, Michaela.
Thank you. I'll just get my first slide up here. Now, what was amazing about this case was when I first read it, it was really absolute luxury to have so much information available for a child, and I got, I think, a bit overexcited about all the things I could do for these twins. But then on second thoughts, the reality is when the children first come in to see the GP with the parents, we're not going to get that information. Usually, parents will, if their child's got physical symptoms, going to be more concerned there's something wrong with their child and want that sorted first. So naturally, parents will be focused more on that. Now, even if the parents do present saying, look, I'm worried my child has tummy ache, I think it's anxiety, a GP is still going to be obliged to, and would be the responsible thing, to still exclude anything medical. I think a really important point that we all need to remember, GPs particularly, is just because you've got anxiety doesn't mean you can't also have a physical illness. And we all see that all the time. Now, if you as a teacher have children like this, you might want to encourage the family to find a GP who takes time or has a special interest in child health. There are postgraduate qualifications GPs do, a diploma of child health. So if your local clinic has someone who's particularly interested, they might be the good first call. And the GP's role in this case is going to be talking to the parents, talking to the child. The child could have a very different perspective to the parents. And if, and a big if, early on, if the family admits that the school is concerned, talk to the school. And that's going to involve time, and that's potentially going to involve talking with multiple teachers, usually the homeroom teacher, and perhaps a special education or supported learning teacher or a counsellor. And that has to be repeated and as needed until you get to the bottom of the matter. And if there's one take-home tip I want to our participants to take home, is that many family members are either embarrassed to mention school issues or don't see that school issues is a priority for them. So it can be really helpful for the GP, for the school to send in a letter to just start that conversation. It's particularly important if the parents actually perhaps anxious, feel there might be something going on, but are actually, as you all know, when people are anxious about something, in the adults you see avoidant behaviour, they might want to go down that path. So if the teacher can drop a line to the GP, and it doesn't have to be your opinion of what you think is going on, it may be just observation, just what's been put in that case. I'm worried about this child because he seems particularly anxious presenting in front of others. So it might be just a little clue that could go in a letter that the family would feel quite comfortable passing on to the GP. So I then looked at the case and I thought both children had what I'd call orange flags or possible anxiety. So in Charlie we saw what might be separation anxiety, social anxiety, daydreamer. Well, it could be just he's naturally a daydreamer, or is he actually worrying and preoccupied? That's something we'd need to explore. Distractible, again, is that because of the worrying? Seems overwhelmed, needs support to initiate his work, and he's one who's had the stomach aches and that increased need for care. James, in a very different way, and this might be temperament, he is very outgoing, not paying attention to social mores like taking turns, seems a bit overactive and competitive, perfectionistic to the point of negative self-talk, easily angry, so his emotional regulation is perhaps compromised, or again part of how he's made, and seems quite intrusive. Now I call them orange flags rather than red flags. It's a very medical term, but you'll know about the red, green and orange in school canteens. Orange means let's have a think about this. So it's really important to remember there might be a baseline normal temperament to perhaps being having some initial troubles with separation anxiety when first starting school, and then that resolving as they settle in, which is quite a normal picture. If it doesn't resolve as expected, so really key things about anxiety is it travelling as you'd expect or not? The other thing, is there a big shift from baseline? So if you've got a child who's generally a little bit tentative and shy and then becomes very much so, that's a difference for them. If you've got a child who's normally quite calm and relaxed and then seems overly intrusive and with emotional outbursts, that's a shift for them. So what's great about being part of the school environment is that teachers are going to get a really good picture of that change from baseline. A GP isn't. So we're grateful for any information we can get and any observations that the school notices that might help us in finding a diagnosis in a timely manner. So causes of anxiety. Usually we need to see the child over several visits. If there's a presentation with a physical problem, easily the first 3 visits are going to be taken up with excluding those issues while we explore, as time allows, other contributors. And the things we think about in the medical model or the psychosocial model is their baseline temperament and personality are important. There are familial tendencies, and they're both genetics and environment. So you can have a family who's got a definite genetic predisposition to anxiety, but mum and dad are well treated, have learned lots of strategies for coping with that, and they're not actually manifesting any of that in their home life. It will be unlikely that that's contributing to the child's anxiety. And there's environmental. If your family of this child is constantly vigilant, constantly worried about things, that is very likely to be transferring onto the child. So you're peeling away layers of the onion. Family stress is really common for the majority of families and can be, whether or not it affects children, is how well the family is able to cope with these things, so economic and relationships. And then the area that I would see more of, and I put this down to the very good measures schools and parents usually put in place, the ones we tend to see where we find out this sort of level of problem is when there may be another developmental concern, because the more, I guess, everyday garden variety of anxiety is very well treated by the measures put in place that Lynn and Marilyn have already discussed, where it's not shifting the way you'd expect. That's really where the GP has a role as a bridging service to more specialist assessments, and that includes things like, is it ASD, is it ADHD, is there a specific learning disorder? That's just another little arm of the decision tree we need to think about. So I just wanted to give a little scenario though that represents the sort of extra information that might turn up for the GP in their appointments. This wouldn't happen all in one visit. Let me just reiterate, this could take several visits and a lot of time. In the event the GP had been really proactive, was very interested in child development, they would have rung the school and had all the information available in the case, but they might not have. But let's say Charlie, tummy aches started 3 weeks ago. Mum can't remember how it began because the family had a very stressful week as finances were tight and they're having trouble paying the rent. Charlie volunteers at this point that there was too much yelling. The tummy aches are typically in the mornings, they never occur in the evenings. And the leg pains happen early in the night, and Mum usually gives Charlie some Panadol and lets him climb into bed with her. There's lots of little orange flags in there that this is more an emotional cause, particularly the somatic symptoms. Now, particularly leg pains, if it was a terrible condition, you'd expect that pain round the clock. The fact that it has a specific time with a reward, you've got to wonder. Tummy ache in the morning, again, if there's a medical problem, you don't have a very isolated pattern. Interestingly, tummy ache in the morning, does that result in being able to stay home from school or not? That's something to explore. And then James. Now, that's in the likely event that James had presented, but with this stem, only Charlie might have presented. So only a very on-the-ball GP is going to say, how's your other child going? So in this case, Mum reports James seems really well. He's almost too well. I can't keep up, and I'm constantly telling him not to do this or that. He even knocked over furniture, leaping from couch to couch while we were trying to sort out the rent that weekend. You've got two children responding in two very different ways to family stress. So James becomes more active, perhaps as a distraction, perhaps as a way to burn off emotional discomfort. Charlie retreats. Now, in this particular situation, what would happen is we'd need to refer to a child psychologist and start a conversation with the parents regarding psychological support for them, plus or minus financial advice or referral on to social services if they were really in trouble. And a really important tip for the school, and one that I find can often be quite challenging, is I can start making a provisional diagnosis, but we are only GPs. We're not experts. We're a gateway to many services, and we have to know as much about blood pressure management, cancer, and child psychological issues. So we're not experts. The reality is, until you've had recommendations from someone who is an expert in this area, who can really provide a good therapeutic plan, only then is the GP in a, I think, appropriate position to make recommendations to the school, and that can take time. So any help that the school can give to the GP in particular scenarios where that family might need extra support is going to be very helpful to perhaps do some band-aid measures until some comprehensive intervention can be put in place. And that was all of mine.
Great, thanks Michaela. And again, lots of information in there, and really highlighting, I think, the role of gathering more information and really trying to understand all the possibilities. So not just leaving it at one thing, trying to be a bit of a detective in there and getting more information. And the family, obviously, and the family, what's going on for the family is a really important part of that. But also information from the school can give you some insight into what's actually going on at school, which is not what you're going to see when you're sitting in your general practice office with the child and family. So schools can provide, and early childhood can provide a lot of information that can really guide you. I can see quite a few questions coming through, but we've got a couple that we might begin with, and then we might see how we go and come back to some of those that are coming through the chat. And I'm really liking seeing people answering each other's questions. Is really helpful to us as well, and having some conversations there along the way, which is great. And obviously there's a lot of knowledge in this virtual space which we're really using, which is great. So I've got a question for you, Michaela, and this is about the role of the GP working with schools. And we might have some GPs in the participants, or some health and community people who might be saying, well, I really would like to work with schools a bit better. What are some of the things that help you in that work and that sort of team approach to working together?
Yes, look, I'm very fortunate because I have a special interest in this area and I've worked in this area a while. I'm lucky to, I guess, sort of evolved over time a relationship with schools for the area that my clinic drains, if you like. It has been a process of learning and growth for me, and also as the school gets to know me. And basically it's about communication. If you feel that there's something not adding up, you find out more. Now, one of the, I guess, one of the hurdles we forget about is privacy law and parents giving permission to provide information. So certainly one of the key steps I've started doing as regular practice is, if I'm asking the school for information, I do it in a letter that goes home with the parent, so the parent feels comfortable about the information going to the school, And then the school can be confident that there's that explicit request and knows what I really want to know. But it's always good to talk over the phone, and you might find out more information over the phone, but in this day and age, you know, so-and-so said this and that on the phone, you're not really going to be able to justify recording that information unless you've got the parent's permission. And it works both ways. If the school is worried about the child, I actually have to have the parent's consent to provide that information. The other thing about a timely letter, and you can get the parent's permission to, if perhaps they're a less organised family, and I have a few of those, to get them to read the letter, document they're happy with it, post it direct. The other advantage of writing to each other is you avoid phone tag, because we're all so busy, and teachers especially between 9 and 3:30 barely have time to, I don't know, scratch their nose, let alone be answering long and complicated calls from a GP who can't figure out what's going on. The other tip, a lot of teachers, when I talk to them, have expressed, look, I don't want to, I think little so-and-so's, he's very anxious because of the domestic violence at home. I don't think I can write that in a letter. Could be, I think there's anxiety because I can see features of autism spectrum disorder, but I know mum has been, that has been suggested to mum, and she's very much against being labelled with a diagnosis. What's really helpful to GP is if a teacher's observation, early learning centre workers' observations, if you can put them down, the GP can draw conclusions from that. So it might be anxious and jumps and cries when there's loud noises, has emotional outbursts when the routine is changed, seems reluctant to go home with dad, but is happy with mum, and you know the parents are separated. You should just put down your observations, because reality is we don't know the exact cause, and it's gathering, it's that detective work, and we work together with that. The other key thing I wanted to say is GPs are not specialists. We have many areas of our work where we are provided with guidelines. So we have perinatal guidelines, we have antenatal guidelines, we have optimal management of asthma guidelines. In my ideal world, I would love to have an education-directed guidelines for GPs, because we're not educators. We are a bridging service, a gateway to other things, and we need all the help we can get, really. So if anyone ever gets excited about that, I'm going to be the first one to help you out. Thank you.
Great. Thanks, Michaela, and another really comprehensive answer. I think schools play a really important role in that observing, and I think people are familiar with Kids Matter. They might know about the Bethel's chart, the observation tool that is in component 4, and that really gives you the chance to document all the sorts of things that you're seeing and really handing that across. So hopefully the school or early childhood service has a process for you to hand that across and to be able to then talk to families, to then have that accessible for GPs and other health professionals, so that that information gathering is happening in a constructive way, and then it makes it easier for other people to really make sense of it as well. Because there will be some things that happen in school and education settings that aren't happening at home, and putting it all together is very important. Now, another question. So, Michaela, you've got a question for Marilyn.
Yes, Marilyn, one of the things I was wondering about was in your opinion, how would you compare individual therapy for children versus or providing support to the family or those carers of that child in learning how to support the child?
Well, I always think that involving the family is crucial. I think that parents actually raise their children with some help from the school and other professionals, but schools and other professionals don't raise their children with a little help from parents. So I think that parents and involving parents at all stages, especially in primary school, is the key. They have the children for 20 years, whereas other professionals are only ever quite short term. I think that what you really probably need is both, but I really do think that in primary schools and early childhood, giving parents the skills to be able to teach the child, to be the therapist for their child, not only is able to reinforce all those lessons so much better over a long period of time, but it also teaches them. And we know that sometimes anxious parents have anxious kids. So in teaching children to self-regulate and to be calm and to face things and to do things that they might be a little bit scared about is also going to help the parent as well as the child.
Great, thanks Marilyn. And again, more information that I guess people can be thinking about. How do we support parents? What's our role? Who can support us to support the parents? And I think that's a really important message as well. Parents can be struggling with children with anxiety, and parents can have their own anxiety concerns as well. So sometimes it's helping them to seek the support that they need. So again, that partnership approach. I can see some questions, and one of them is kind of a statement from Kate Strom about siblings of children with disability, really acknowledging that one of the groups that perhaps gets missed in when we're thinking about families and children, it might be that we're thinking about the child with a disability and the needs around that, but siblings of children with disabilities can have their own mental health difficulties, and anxiety might be one of those, and they might need some specialised support alongside the disability support that the family is receiving. There's also some questions around GPs that I've noticed. I saw some that were talking about deficits like magnesium deficits and zinc and things like that. So Michaela, I'm not sure if you'd like to comment on anything that you might be thinking about as a GP in terms of any of those sort of vitamin type things.
Look, always you've got to look at the whole health of the child. That's where your GP is invaluable. That's our job. Look for the common things, exclude the nasty. There are tests that can be done, but of course we don't jump into doing blood tests on children unless there's an indicator. So things like magnesium deficiency results in things like unusual muscle cramps with a particular pattern. So there's always these clinical clues. I must admit, I'd say there's a very large proportion of kids I see who are iron deficient or vitamin D deficient. And interestingly, I have a few kids who present as, gosh, they're acting like they've got ADHD. They've never been like that before. We check their iron. Iron's low as anything. Fix the iron, they're back to normal. Because kids need energy to be still and calm. So I do think having a nutritional check and a growth check and a development check with the GP is all very much a part of what's needed for a child who might be having issues in any area of their life, not just anxiety.
Yep, okay. And there's another question that's specifically for GPs, so I'll hold you there again. Do GPs specialise, so you've got a particular interest in children's mental health, but there's a question around whether people are able to find GPs that do specialise in issues like anxiety.
Look, there are many GPs trained in mental health counselling. There used to be a directory on the Beyond Blue site, but they recently took that down largely because all the GPs listed were booked out, and the poor old people trying to find someone on the internet were just frustrated. And it was found that the best pathway was to ring your local clinic, find out which of the GPs in their group has a special interest in mental health. There'll be two. There'll be ones who are generally interested in mental health, and then there'll be some like me who have had postgraduate training in counselling. So I do interpersonal therapy, cognitive behavioural therapy, a bit of that sort of thing. So I'm particularly interested in child development. So many GPs will have their hands up as mental health or child health special interest. So it does mean a phone call to the local clinic. Many parents don't have time. So as a teacher, if you think the parents are perhaps dragging their feet in getting seen by someone or reporting they're having a lot of difficulty getting in, it would be perfectly appropriate for the school to ring the local clinic and say, which of your GPs is interested in seeing children, and getting a name to suggest to the family.
Right, that's a great tip. Thank you for that. And I think we've got time for one more question, maybe for you, Marilyn. We've had a question from Monda, which is quite specific, but talking about a 7-year-old who's crying constantly, complaining with sore throat at school, worried about the child, that mum's not going to come back to pick him or her up, and that refusing to go to school in the morning. Any top couple of tips for this kind of situation?
School refusal is a very difficult problem, and I think that there has to be a decision tree. So is the child actually afraid of something at school? Are they afraid of being bullied? Are they afraid that they have a learning problem? Or is it that they don't want to leave mum or dad? So you've really got to tease out which part of that school refusal where they have that anxiety to be able to treat it. Because you could, if a child has separation anxiety, you can say, that's fine, you don't have to go to school. You can go to Dream World today, but you can't go with mum, and they still wouldn't go. So sometimes schools bend over backwards thinking that reluctance to go to school is always about school, but it's only sometimes about school, and it's sometimes that you've got to address the home situation as well.
Yeah, great. Thank you, Marilyn. And again, highlighting that gathering more information, understanding what the anxiety means is probably the message that I'm taking away. We've just got another few more minutes. So Marilyn, just coming back to you again, last thoughts, recap, what would be a takeaway message overall for people?
I think that the takeaway message is that we know that anxiety is growing in young people, whether it's from diet, whether it's from the environment, whether it's from whatever causes it is, that it is growing. And I think that we always need to take it very seriously. There are some kids who go through developmental phases where they become anxious about something and they grow out of it. But a lot of kids don't grow out of it, and we really have to, as much as we can do as teachers, is to remember to refer on when the problem doesn't seem to be working. Just as Michaela says, if the problem is still there 3 and 4 years later, then what we're doing isn't working. We've got to do something else.
Great, thank you. And Michaela, perhaps the final word across to you. Take-home message?
Take-home message, let your GP know if you've got concerns. I noticed that someone's written a question, when would you suggest parents go to a GP when there's a behaviour change? And certainly, I guess, is reflecting what Marilyn said. If normal measures that you put in place aren't helping, and even if they are helping but needing to be sustained for quite a long time and it's not becoming normalised or natural. And the bottom line is follow your instinct. If it's not sitting right, you'll be having that feeling for good reason. You might not be able to put your finger on the details. Do an observation chart. When in doubt, get it checked out.
Yep, great. That sounds like a great slogan, really. When in doubt,
I use it all the time.
Get it checked out. So that's a great takeaway message. Thank you. All right, we need to really wind up. I can see there's more questions coming through, and I know there's lots and lots of interest in the topic, and we've really just touched the surface. I am hoping that people have gained some ideas from the session this afternoon and have got some ideas of where to get some more information. Just a reminder about Kids Matter. I'm sure people are getting more and more aware of this, but Kids Matter is an Australian mental health initiative in primary schools, early childhood education and care services, bringing together really what we've been talking about tonight is a perfect example of that, getting people to really understand children's mental health, listen to what's happening and work together so the adults are working together. We know that children who are mentally healthy grow up and are more likely to be resilient and to be able to learn and have strong, healthy relationships and deal with the challenges of life. Websites, follow us on Facebook and Twitter. We're always trying to keep you up to date with what's going on, so sign up for the newsletters as well if you haven't already. And we will be having more of these webinars. This is the last one for this year, but we will continue these series right through until June next year, kicking off again in February. And the February one, we've yet to set a date, but we'll let you know. And the focus will be on infant mental health. So certainly, picking up on some of the conversation today. Certainly for early childhood people, health and community professionals, but primary school people may find some of that interesting as well. So thank you very much for your participation. It's been lovely having you all part of the conversation this afternoon, and I can see lots of thank yous and people saying some lovely things. So thank you very much for that as well. We've enjoyed doing this planning and doing this work with you today, and we do really hope that it is helpful. And just a reminder that you'll have an exit survey that will come up on your screen in a moment when we close down, so that you can give us some feedback and really give us a chance to really understand what helps you the most and what sorts of things you take from these sessions. So thank you very much, and good luck with the ideas that we've shared tonight. And thank you all very much.